CCI, craniocervical instability, is very, very important if you're hypermobile. So let's talk about the basic stuff and some of the things that you need to be aware of. Craniocervical instability means how your head is sitting on your neck. That very first and second bones in your neck are very, very important, and in some people with hypermobility, they're more unstable than others. I treat joint hypermobility, and I always assume the person I'm dealing with has some degree of CCI, craniocervical instability. So first, let's understand the movement of your head over your neck. So what I like for you to do is to cup your neck with your hands and bring your elbows in. So do this with me. And then what I want you to do is the top of your hand, as it's cupping your neck, is going to feel the back portion of your head, or the bottom portion of your head. So what I want you to do is to just look up and down. Look up until the back of your head touches your pinky. Up and down, side to side, and rotate to rotate. What your hands are feeling is essentially neck movement. We don't want to move our neck. I want you to be able to differentiate between your head movement and your neck movement. Now, what ends up happening that I see in my practice quite a bit with my zebra patients is that there is a lot of head over neck movement, and the neck muscles don't do what they are to do. And then you use a lot of the front of your neck to shove the neck back and try to control the neck with the wrong muscles. This can lead into engagement of your scalenes and a series of issues that come from that, some of which involve your fingers. So we're not going to make this video into a scalene issue, but I want you to understand every part of your body has to manage its own movement, has to carry its own weight. When your head muscles carry the task of neck movement, you've got a problem, and the level of instability is increased because the two parts are not managing their own section. So we want to pay attention to the mistakes that we make. We also want to pay attention to the lifestyle that we have that feed this problem. So for example, looking at your devices and looking down like at your laptop or iPad is not a good idea. Everything should be higher up, bigger font, 25 inches from your face, and you're looking at the middle of the monitor, slightly above the middle, downward. So you're not looking up or you're not looking down. So you're looking straight at your monitor. There are different things that you can do. For example, sleeping on your tummy is a big no-no, because that was excess rotation, and it's kind of like standing up and looking to one side all night long. So there are different things. I've done videos on these. If you have not subscribed to my channel, please make sure you do. And I am on social media, even though it's kind of like, be careful how long you are on social media. But I do use social media to try to communicate all the little tips and short little things that I think would be helpful for you. But subscribe to my YouTube channel and make sure you turn the notification bell on so you get notified. So back to some of the other things that you can do. Let's talk about the position of your tongue to the roof of your mouth. So go ahead, and your tongue, middle of your tongue, should be most often touching the roof of your mouth, unless you're hypermobile. So practice that, and then also practice swallowing. When you keep the middle of your tongue to the roof of your mouth and you practice swallowing, you're working out deeper muscles in the back of your throat, which are helpful with your CCI. They're in front of the section, and the integrity of the whole structure makes a difference. Another thing that is very important to remember is avoiding opportunities where your neck is in hyperextension. This is, for example, when you see your hairdresser and they're washing your hair. So you could, or seeing a dentist, or seeing any provider where your neck is into hyperextensions, just lift it up like so. So if you put a soft neck collar on when you see these providers, then they will accommodate your need and they do things differently based on what they see. So you're not faking anything, you're just protecting yourself, which is not a bad thing. Avoid roller coasters. I know I love roller coasters myself, but it's one of those activities that do a lot of damage for you. So it would really suck to be involved with instability any more than you need to. We can see the instability in the cervical spine by doing flexion extension x-rays, by doing dynamic MRIs and motion x-rays. We can see how much instability exists there, just so you know. One of the things that exercise-wise that I'd like, and I definitely ask my patients to do, are the neck gliding. So I want you to know that when I glide my neck back, it's the back of my neck muscles that will grab my neck and pull my neck back. I don't drop my chin down to then shove my neck back. That does not involve the back of my neck muscles. And that is a big problem, because when the neck needs to go towards the back, if I keep using my SCM and the front of my neck muscles to shove the neck back, I will end up with TMJ issues as well. So practice gliding your neck back, being mindful of not dropping your chin down, you're not looking up either, just parallel to the ground and move the neck back. This comes with the practice. But guess what? When you were 6 weeks old, between 6 weeks to 3 months, you were put on your tummy. That was called tummy time. And during tummy time is when you started putting life into the back of your neck muscles. So I'm going to show you tummy time. I'm going to show you late 3 months, which is another great exercise that practices this area. And of course, I just showed you the neck gliding. So let's do the tummy time. So you can do this with me or watch it and then pause and do the exercise yourself. You're going to be on your tummy and your elbows are pushed out like as if they're going towards the opposite walls, and you're pressing down on your elbows onto the ground. You are on your forehead, and just remember, when you're pressing your elbows down, your shoulder blade gently is the key word, slides down your back. It is not a jerky move like so. So be careful when you're hypermobile. The tendency is for movements to be more jerky and rapid. So we want to tone it down by about 40%, I would say. So you're on your forehead, you're pressing on the inside of your elbows, gently connecting to your shoulder blades. You scrape your nose, get the tip of the nose off, look up another couple of inches and hold. This is where your head movers did their job and now they're holding on to the head. Now we're using the neck muscles, which start from between the shoulder blade higher up on the shoulder blade. So about where I'm pointing, there are muscles that are attached there, and there's a strip of muscle that goes on the right side and left side and gets attached to the back of my head. So from the mid-back, that's the key. So remember, you hold your head in that position, and from the mid-back, you glide your neck up and you hold. So it's a mistake when you go there and you look up and do that. That's a mistake. So you're holding your head in position, gliding your neck up, and then with that upward pull still existing, you slowly turn your head to one side back to the center, and to the other side. The whole time, the inside of your elbows are pressing to the ground. The next one I'm going to show you is what you did towards the end of the 3rd month of your age. So remember how you were like this? You slide your hands under your shoulders so they're not too far back, and they're not so the fingers are, if I draw a straight line from the top of my shoulders to the ground, my fingers need to not go beyond that. So I'm going to bring it back behind that line. I'm going to go on my forehead, scrape my nose, get the tip off, look up, and hold. That's the job of my head movers. The top of my shoulders will go away from my ears, and now from my elbows to my wrists, I'm going to push the ground up, away, and get my chest off. You're not doing a cobra. You're simply getting your chest bone off the floor. This is so important for you to do, and to realize that you're not looking up with your, like you're not moving your head anymore, and you are breathing biologically. You probably don't know what biological breathing is, which is the reason why you should make sure you subscribe to my channel, because I have done this. I did this video a long time ago. I refer to it always. We'll make sure we put it at the end of this video, but make sure you subscribe to the channel, because there are a lot of things you need to be aware of, and these are micro little steps in the right direction that make a huge difference. So during these exercises and anything else that you do, you are to breathe correctly, breathing biologically. I hope this video helped you. I hope you saw that this does not hurt anyone. This is what you did. What I just showed you is what you did the first 3 months of your life, and they're low impact on the joint and highly effective. Thank you so much for watching. If you need help with your joint hypermobility, please contact me. I know I can help you. Thanks for watching.